Good morning and welcome to the class on alcohols. At the end of this class, you will be able to define what an alcohol is, what are the important types of alcohols clinically, what are the uses of methyl and ethyl alcohol, and how is acute and chronic alcoholism treated with how do we treat methyl alcohol poisoning. So organic chemistry tells us that the word alcohol is derived from the Arabic words alcohol and alcohol. Basically it refers to the process by which the alcohol is produced by a process of sublimation and distillation. Antimony sulfide, which was used as an eyeliner, was produced by this process. It also refers to the effect of alcohol on the mind, means to take away the mind or to cover the mind. Brewing, that is producing alcohol from fruit sources, is considered to be the second oldest profession in the world. Now the alcohols are classified based on the number of hydroxyl groups present. That is, the alcohols are hydroxy derivatives of aliphatic hydrocarbons. So we have monohydroxy alcohols, namely ethyl, methyl and propyl alcohol. Dihydroxy alcohols include ethylene glycol and propylene glycol. Glycerol is a trihydroxy alcohol. Mannitol and sorbitol are polyhydroxy alcohols. Conventionally, the word alcohol refers to ethanol or, more technically correct, ethyl alcohol. Now, for the pharmacology and the effects of ethyl alcohol. Ethyl alcohol is the main constituent of all alcoholic beverages, obtained by fermentation of sugar by yeast and from molasses. Molasses is a byproduct of the sugarcane industry. In some parts of the world, like in the West Indies, alcohol is obtained from a type of beetroot called beet sugar. Different types of alcoholic drinks are there. We have the malted liquors, wines, spirits, etc. Absolute alcohol refers to 99% weight by weight ethanol. That is ethyl alcohol of 99% pure. Rectified spirit is 90% ethanol. When we say rectified, it means 9% is made up with the addition or by the addition of methyl alcohol. Methylated spirits contain 95% ethanol and 5% methanol. Proof spirit refers to weight by weight 49% or 7.1% volume by volume ethanol. Now these rectified spirit, absolute, proof spirit, they all refer to the purity of ethyl alcohol. Coming to the actions of ethyl alcohol in human beings. On local application, it has a rubefacient action. That is, when alcohol is applied to the skin and rubbed with friction, it causes dilatation of the blood vessels and that area of the skin feels warm. Alcohol has an astringent action. Astringent meaning it precipitates surface proteins without injuring the mucosa. Antiseptic. Above 70% alcohol kills pathogenic microorganisms on living surfaces. Alcohol also acts as a counter irritant. That is, it stimulates the superficial sensory receptors. Those of you who shave and use an aftershave would have experienced this cooling and refreshing effect of alcohol. When alcohol is injected around a nerve, it damages that nerve permanently, and this effect is used in the treatment of trigeminal neuralgia. Alcohol is also used to prevent bed sores in chronically bedridden patients. Alcohol is a CNS depressant. It is a neuronal depressant. On the cardiovascular system, it produces dose-dependent effects. Small doses of alcohol cause cutaneous vasodilation, so the person feels warm. In moderate doses, there is an increase in heart rate and blood pressure. Large doses cause depression of the myocardium and the vasomotor center in addition to causing global CNS depression. On blood, this is again with chronic intake. There can be megaloblastic anemia, decreased LDL and increased HDL levels. Body temperature, like we said earlier, because of peripheral vasodilatation, there is increased heat loss and the person has a sense of warmness. And in cold countries where a person is dressed for the cold weather, it can cause paradoxical undressing. I want you to read up what is this paradoxical undressing from forensic medicine. Effects on the liver. There is impaired gluconeogenesis, decreased albumin and transferrin synthesis, triglyceride levels are increased, there is decreased fatty acid oxidation. So there is accumulation of fatty acids in the liver, resulting in a fatty liver. Acute alcoholism is an enzyme inhibitor, whereas with chronic alcoholism, there is microsomal enzyme induction. On the gastrointestinal tract, acid secretion in the stomach is increased, so it can cause gastritis and peptic ulcers. Due to inhibition of antidiuretic hormone, consumption of alcohol causes diuresis and increase in water intake. The effect of alcohol on sexual desire. The desire is increased, but the ability to perform the sexual act is taken away because of CNS depression. Endocrine effects are multiple. Testosterone levels are reduced, so chronic alcoholics, male chronic alcoholics can exhibit gynecomastia, decrease in sexual drive or libido. Increased adrenaline levels are seen. Increased adrenocorticotropic hormone. Ethyl alcohol is a tocolytic, that means it suppresses uterine contractions and can be used to prevent premature labor. Now coming to the pharmacokinetics of ethyl alcohol. Ethyl alcohol is metabolized by alcohol dehydrogenase, which is a non-specific enzyme, to acetaldehyde. Acetaldehyde is converted to acetic acid or acetate by again a non-specific enzyme called aldehyde dehydrogenase, and the acetate is broken down to carbon dioxide and water. Now these two enzymes, alcohol dehydrogenase and aldehyde dehydrogenase, are non-specific enzymes, meaning alcohol dehydrogenase will convert any alcohol to the respective aldehyde, and aldehyde dehydrogenase will convert the aldehyde to the respective acid. For example, ethyl alcohol to acetaldehyde to acetic acid or acetate. If it was methyl alcohol, it becomes formaldehyde and formic acid. In low doses, ethyl alcohol follows first order kinetics. That means the amount excreted is proportional to the plasma concentration. With larger doses, ethyl alcohol follows zero order kinetics. That means the amount of alcohol excreted per unit time is a fixed amount and not a fixed percentage. So if a person has had too much to drink, the next day the person experiences a hangover because all the alcohol has not yet been completely eliminated. Now the question most frequently asked, especially to a doctor, is what is the safe amount of alcohol which can be consumed? There is no agreement on what is safe drinking. Just as a guideline, one drink that is of rectified spirits like brandy, whiskey, rum, gin or vodka, 50 ml, approximately 20 grams of the alcohol is considered safe. Because rum, brandy, whiskey, gin, vodka, etc., these contain ethyl alcohol in this strength, 45 to 55%, which is equal to 150 ml of wine or 400 ml of beer. Now this is just a guideline. Okay, there is absolutely no specific amount which can be classified as safe drinking. Coming to the adverse effects of ethyl alcohol. On moderate drinking, there is going to be nausea, vomiting, flushing. Person can experience a hangover and epigastric distress and gastritis. Acute alcohol intoxication, when a person has consumed quite a lot of alcohol in a single sitting. There is going to be hypotension, gastritis, hypoglycemia, cardiovascular collapse, respiratory depression, coma, and very rarely death. So these are the features of acute alcohol intoxication. Chronic alcoholism is when a person is consuming more than the safe amount of alcohol over a long period of time. It produces dependence, both physical and psychological dependence, leading to cirrhosis of the liver, hypertension, cardiomyopathy, congestive heart failure, arrhythmias, skeletal myopathy, peptic ulcer, neuropathy, Wernicke's encephalopathy, Korsakoff psychosis. Now these two conditions, Wernicke's encephalopathy and Korsakoff psychosis, you will learn more about them in pathology and forensic medicine. Can cause malignancy, especially of the stomach. And if a person who has been consuming large amounts of alcohol over a long period of time suddenly stops, the person will experience withdrawal syndrome, characterized by nausea, vomiting, headache, palpitations, tremors, restlessness, anxiety, and finally it can cause convulsions. Hyperlipidemia is another adverse effect of chronic alcoholism, pancreatitis, hyperuricemia, hypomagnesemia, respiratory infections. So with chronic alcoholism, every organ system gets affected. Excuse me. Now next we will see the two definitions of what is alcoholism. The American Society of Addiction Medicine defines alcoholism like this: primary chronic disease with genetic, psychological, psychosocial and environmental factors, which is progressive and fatal, characterized by continuous or periodic impaired control over drinking, in spite of knowing the adverse consequences, and the alcoholic will deny that he or she has a problem with alcohol. A very similar definition is given by the World Health Organization. Again, chronic, continual or periodic excessive alcohol drinking, intoxication, preoccupation with alcohol, use of alcohol in spite of knowing the adverse consequences. Coming to the uses of ethyl alcohol, we are talking about the medical uses. As an antiseptic, ethyl alcohol is used in methyl alcohol poisoning. Why it is used, we will do when we do ethyl alcohol poisoning. Injected around the nerve in severe trigeminal neuralgia to prevent bed sores. Again, whether this can be classified as a medical use is controversial. 10% alcohol as an appetizer, counter-irritant and rubefacient. To reduce increased body temperature, alcohol sponging can be done. Intravenous ethyl alcohol is also used in ethylene glycol poisoning. Ethyl alcohol is contraindicated in peptic ulcer, liver disease, pregnancy, because if alcohol is consumed during pregnancy, the fetus is going to be damaged, resulting in fetal alcohol syndrome. Epilepsy is another contraindication. A person with history of mental illness is a contraindication. Now, the alcohol dehydrogenase inhibitors are used in the treatment of chronic alcoholism. Like we said earlier, alcohol is converted to the corresponding aldehyde by aldehyde dehydrogenase. Now these two drugs, disulfiram and citrated calcium carbamide, inhibit aldehyde dehydrogenase. So what is the result? Inhibition of aldehyde dehydrogenase results in the accumulation of acetaldehyde in blood. Now this increased blood acetaldehyde levels will result in what is called the acetaldehyde syndrome or disulfiram reaction. Disulfiram reaction is characterized by nausea, metallic taste, abdominal pain, drowsiness, headache, nervousness, malaise, cramps, rashes. So what happens? Disulfiram and citrated calcium carbamide are used in the treatment of chronic alcoholism or also called alcohol de-addiction. This is also called aversion therapy. Now what are the features of aldehyde syndrome in addition to what we mentioned earlier? So a chronic alcoholic, that is a person who has got a drinking problem, is admitted to a hospital, and the first 10 days no alcohol is given. Instead, disulfiram is administered in the dose of about 1 gram every day, followed by what is called alcohol challenge. After administering disulfiram for 10 days, the person is given a drink. So what happens? The alcohol is ethyl alcohol is converted to acetaldehyde. Acetaldehyde is not converted to the acetate because disulfiram inhibits aldehyde dehydrogenase. There is an increase in the levels of blood acetaldehyde levels resulting in aldehyde syndrome, which is characterized by severe nausea and vomiting, flushing, palpitation, hypertension, severe sweating, headache, dizziness, confusion, visual disturbances. Patient may even collapse. There is tightness in the chest. So all these make it very, very unpleasant. So the logic here is to make the alcoholic understand that when disulfiram is being taken, if the person consumes alcohol, these are the unpleasant things which are going to happen. Therefore, alcohol should not be consumed. That is, the alcoholic is supposed to develop an aversion or a dislike for alcohol. There are other drugs which can cause antabuse-like reaction. You will be told later. For example, metronidazole, which is used in amoebiasis, and chlorpropamide, which is used in the treatment of diabetes mellitus. Which are the other drugs used in the treatment of chronic alcoholism? For reducing withdrawal symptoms like nervousness, anxiety, insomnia, we use chlordiazepoxide, which is a long-acting benzodiazepine, diazepam, again a benzodiazepine, and to reduce the adrenergic symptoms like tremors and sweating, propranolol, a beta blocker is used. Naltrexone, an opioid antagonist, has been tried. The anti-epileptic drug carbamazepine has been tried. Topiramate, again an anti-epileptic, has been tried. Skeletal muscle relaxant, baclofen, has been used. One of the recent drugs in treating chronic alcoholism is Acamprosate. This can be a 3 or a 5 mark test. It is an N-methyl D-aspartate receptor blocker, and it also increases the actions of GABA in the central nervous system. It is used for maintenance therapy of alcohol abstinence. Now what does this mean? We will describe. The antiemetic ondansetron has also been used. And finally, we have a group called Alcoholics Anonymous, a self-help group for the treatment of alcoholism. Acamprosate, like we said, is a 3 or a 5 mark question. The mechanism of action is, it is a weak NMDA receptor antagonist and has agonist action at the GABA-A receptor. So, Acamprosate reduces craving. That is, a person who has consumed alcohol for a long time has successfully been treated and has stopped drinking. Now, in such an individual, Acamprosate is given and it reduces the craving. That is, the person does not feel like taking a drink. The dose of acamprosate is 666 mg 3 times a day per oral. Adverse effects are very mild: gastrointestinal upset, that is nausea, vomiting, diarrhea, and skin itching. Methyl alcohol is clinically important because it is a common cause of poisoning, whether it is accidental or suicidal. So what happens when methyl alcohol is consumed? It is acted upon by alcohol dehydrogenase and converted to formaldehyde. The formaldehyde which is produced is acted upon by aldehyde dehydrogenase and converted to formic acid, which is the toxic form of methyl alcohol. So if in some way we can reduce the formation of formic acid, we can reduce the toxicity of methyl alcohol. Formic acid is a very poisonous substance, and one of the first tissues to be damaged is the retina. There will be severe hypotension and collapse. There is going to be acidosis because of accumulation of formic acid. CNS depression is going to be there, respiratory failure, severe vomiting and headache, epigastric pain, bradycardia, and of course finally respiratory failure, coma and death. Treatment of methyl alcohol poisoning is important not only from the clinical point of view but also from the examination point of view. The patient is kept in a quiet, dark room and the eye is protected from light. Because even in the retina, the retinal system can convert formaldehyde to formic acid in the retina and the retina gets damaged. Gastric lavage with sodium bicarbonate intravenous to combat the acidosis, and 10% ethyl alcohol is administered intravenously. Potassium chloride infusion to combat the hypokalemia, calcium leucovorin to enhance the metabolism. Where facilities are available, hemodialysis, and formapizole, which inhibits aldehyde dehydrogenase, is also used in both methyl alcohol poisoning and in ethylene glycol poisoning. Now, what is the reason for using ethyl alcohol in methyl alcohol poisoning? Now remember, the enzymes alcohol dehydrogenase and aldehyde dehydrogenase are non-specific. So in a person who has consumed methyl alcohol, the objective is to prevent the methyl alcohol from being converted to formic acid. So when we give ethyl alcohol intravenously, ethyl alcohol competes with methyl alcohol for aldehyde dehydrogenase and alcohol dehydrogenase and saturates both these enzymes. So the key words here are competition for the enzymes alcohol and aldehyde dehydrogenase and saturation of these two enzymes by ethyl alcohol, so that methyl alcohol is not converted to formic acid. So the possible questions from this topic are: name 2 drugs used in the treatment of chronic alcoholism, or give reason disulfiram is used in the treatment of chronic alcoholism, or a 5-mark question: treatment of methyl alcohol poisoning. Acamprosate is a 3 or a 5-mark question. Thank you for your patient listening.